Read all of the package leaflet carefully before you start taking this medicine. Your doctor, nurse or pharmacist should show you how to use your inhaler and volumatic device. If you have any questions, speak with your doctor, nurse or pharmacist. A volumatic is a large volume spacer device which helps you get the most out of your inhaler by allowing more medicine to get down into your lungs. To start using the volumatic, fit the two halves together, making sure that you line up the notch on one half with the slot on the other, and then press the two halves firmly together. The medicine is contained in a pressurized canister in a plastic casing with a mouthpiece. Remove the mouthpiece from the inhaler by gently squeezing the sides with your thumb and forefinger and pulling apart. Check the inside and the outside of the inhaler to make sure that the mouthpiece is clean and free of objects. When using your inhaler for the first time, it is important to test whether it's working properly. To do so, point the mouthpiece away from you and release 1 or 2 puffs into the air. Then shake the inhaler 4 or 5 times to ensure that any loose objects are removed and that the contents of the inhaler are mixed evenly. Just before using the inhaler and volumatic device, try and breathe as slowly as possible and stand or sit in an upright position. Once ready, fit the inhaler into the end of the volumatic opposite the mouthpiece. Check the mouthpiece of the volumatic inside and out to make sure that it is clean. Hold the volumatic facing towards you, keeping the inhaler upright with your thumb on the base below the mouthpiece. Breathe out as far as is comfortable, and then place the mouthpiece in your mouth between your teeth. Close your lips around the mouthpiece, but do not bite it. Press down with your finger on the top of the inhaler to release 1 puff of medicine. Then take 1 deep, steady breath, or 5 normal breaths, to make sure that the medicine goes into your lungs. Please note that you do not need to remove the volumatic from your mouth when exhaling. You should hear the mouthpiece valve click or rattle as you breathe through the device. If you do not hear it, please tilt the volumatic up slightly and then try again. Whilst holding your breath, remove the volumatic from your mouth and remove your finger from the top of the inhaler. Continue to hold your breath for a few seconds or for as long as is comfortable. Then breathe out. If your doctor has prescribed that you take more than 1 puff of medicine, remove the inhaler by tilting the top forward. Wait 30 seconds and then repeat the same process. Afterwards, rinse your mouth with water and spit it out, or brush your teeth. This may help to stop you getting thrush and becoming hoarse. After use, remove the inhaler from the volumatic and always replace the mouthpiece cover immediately after inhaling. This will help keep the inhaler clean. When the mouthpiece cover is fitted correctly, it will click into position. If it does not click, turn it around and try again. Do not use too much force when replacing the mouthpiece cover. Your volumatic should be cleaned with warm water and mild detergent or sterilizing solution at least twice a week. Please use a soft brush to remove any film which forms on the valve of the device. Rinse thoroughly with clean water and let it air dry at room temperature before storing it in its carton. If you have any questions about using the inhaler and volumatic device, please speak with your doctor, nurse or pharmacist. As with all inhalers, caregivers should ensure that children prescribed Seretide Evohaler use correct inhalation technique.